Ready for round 2 of our sustainability talks for Tuesday. As part of Texas A&M's Virtual Earth Month, we're definitely happy to have you join us tonight. So what we have tonight is we have Faiza Hasan, and she is a environmental geosciences major, class of 2022, and she's got a really interesting talk looking at how different countries have handled COVID-19, the different responses, stimulus packages, things like that, and just kind of comparing and contrasting those and seeing what we can learn from the different decisions that have been made and how that has impacted those countries and those communities and the people that are living there. So basically, if you have questions, throw them in the chat. And also that green bar on the top, if over to the right of it, you'll see my name, and over to the right of it, if you turn that into side-by-side mode, it's going to be the best way to view this presentation. So with that, I'm going to pass it over to Faiza. She's going to share her screen, and she'll take it away from there.
All right, thanks, Ben. Okay. Okay, hi, I'm Faiza, and this is my sustainability talk titled Responses to COVID-19, How Certain Groups Are Being Left Behind. Just to do a brief overview of what I'm going to be covering, I'm going to be going over how different countries are handling the crisis, what their stimulus plan is, and how their most vulnerable groups are being affected. So we're going to start in China. Here's a brief COVID-19 timeline covering about the first 30 days of the outbreak in China. On December 31st is when they had their first few confirmed cases. They thought it was pneumonia at first, but they found out pretty quickly that it was COVID. January 11th, unfortunately, they had their first COVID-related death. January 23rd is when they went into lockdown. And January 30th is when they started to offer cash subsidies to healthcare workers. And from here, they started building a plan to provide aid to other citizens. So their financial aid looks a little different in Hong Kong and mainland China. This is because Hong Kong, China has a democratic form of government, whereas mainland China is run by the Communist Party of China. They do, however, share the same president. So in Hong Kong, they're offering about a $1,200 cash subsidy to permanent residents. They're offering 1 month worth of rent to anyone living in public housing. They're implementing tax cuts, and they're also giving 1 month extra worth of aid to anyone collecting old age or disability benefits. Mainland China, on the other hand, has made a very conscious decision not to implement any fiscal stimulus. This is because they, in order to come back from the recession, they spent about $2 trillion, and their economy has become pretty complex. They've become one of the world's most indebted economies in less than a decade due to some actions that they did take during the recession. So they don't really have much money to give. They are giving consumer vouchers that are prepaid by the government. However, there's not a lot of money on them, and they're giving them because they want to try to stimulate the economy, and they want people to shop from certain areas. And also they're providing emergency subsidies in certain provinces. I know in Wuhan, they are giving a $72 emergency subsidy for anyone who needs it. And finally, because they're not implementing any fiscal stimulus, they do have a lot of heavy emphasis on monetary stimulus, meaning that they're focusing on their banks. So in my research to try to find how people are doing in China, how people are being affected by this pandemic, I found this article titled "In Coronavirus Fight, China's Vulnerable Fall Through the Cracks." It's written by an individual named Wan Li, and she resides in Hong Kong, and she writes for the New York Times. She's done a really good job at providing a lot of first-person accounts of how people are doing at this time. So a 16-year-old boy with cerebral palsy actually died of starvation after his father and his brother as well were taken to the hospital because they were diagnosed with COVID. A young couple who were migrant workers had to leave their newborn son at the hospital because they didn't have any money. There's no way to be employed right now. And again, China isn't providing any fiscal stimulus, and you can't necessarily use consumer vouchers to pay for your child. A 6-year-old boy was found in an apartment with the body of his grandfather. And additionally, on the day of the lockdown, deaf residents in Wuhan and in other areas didn't really know what was happening until they had trouble taking public transportation. So these are just 4 out of many stories that are coming to light as the outbreak progresses of how people are suffering during this time and how it's harder on certain people than it is for others. So I did want to focus on China's wealth gap real quick. Their income inequality is pretty big. You can see the top 10% and the bottom 50% have quite a large gap. So the bottom 50%, most of them are employed in China's informal economy. And because of this, they're not really protected by social security or unemployment benefits or anything like that. And they're also a lot more vulnerable to the pandemic because they're working in jobs such as garbage collection, or they're working in markets where they're coming into contact with people, but then they don't have the help that they need to get care if they do get sick. Additionally, China lacks a little bit in their welfare system in that in urban areas it's readily available, but in rural areas it's a little bit harder to get aid. And so because of this, it's causing a bit of a problem since most low-income individuals are living in rural areas at this time. Additionally, the cost of food, medicine, and supplies have really peaked since the outbreak. And a professor at the London School of Economics, his name is Kent Dang, has stated that the bottom 50% or the lower and middle classes will be completely impoverished by this time next year if things keep going the way that they're going, and their savings will be completely dried up. So though I know that it's unrealistic to say things will keep going this way for another year, I think 3 months are pretty reasonable. And if in 1 year their savings will be completely dried up and they'll be completely impoverished, then I don't think it's a stretch to say that in 3 months they'll be taking a very large economic hit that will be very, very difficult to come back from. So this is a quote from that New York Times article that I had mentioned earlier. Ms. Zhang is one of the deaf residents in Wuhan who's living off that $72 emergency subsidy, as well as a $140 disability check that she received before the outbreak. And I wanted to use this to show that income inequality is a problem everywhere. And unfortunately, it kind of causes a disconnect between the top 10% and the bottom 50%. And oftentimes people who are doing well find it hard to have any empathy for people who aren't doing well. Like, even in times like these, Ms. Zhang wrote into her neighborhood group chat that she could not afford her groceries, that she was really struggling to pay, especially now that the price has gone up at least 4 times. And in response, her neighbors told her that if you're poor, go live in the countryside. And so she wrote into the New York Times saying, there are many poor people in the world, but when the others question why you are so poor, you have no way to explain. So moving on to India. This is India's COVID timeline, and on January 30th, they had their first case. On March 15, 2020, they had their first 100 confirmed cases. On March 24th, they announced their lockdown, and on March 26th is when they started discussing aid packages. I do want to say that on March 15th, they said that they had their first 100 cases, but that's very unlikely because India so far has followed, their numbers have followed an almost textbook case of the virus. And with the numbers that they are giving right now, those numbers should only be possible under ideal quarantine situations. And India right now is not an ideal quarantine situation. So they most likely have a lot more people who are sick right now than they're letting on. So here's India's stimulus package. In terms of what is being given, they are giving rice or wheat to every individual in a low-income family. They're giving 5 kg, which is about 11 pounds, and they're also giving lentils. In terms of monetary aid, they're only giving 500 rupees, which is about $7, which is about 1 grocery trip in India. How much money is going into this package? Well, it's 1.7 trillion rupees, or $22.5 billion. Just to put this into perspective, the United States has about 330 million people, and our aid package is about $2 trillion. But India has a population of 1.3 billion, and their aid package is only $22.5 billion. So it's not that, comparatively, it's not really enough money to help as much as they should be helping. Additionally, most countries are putting about 20% of their GDP into their aid packages, whereas India is putting less than 1% in. How many individuals will be helped by the food security? The chief of finance in India has stated that 800 million individuals will be helped, but again, they have a population of 1.3 billion. How often will this aid be received? This aid is supposed to cover them for about 3 months, but the lockdown is only 21 days. So ideally, they should be able to leave after these 21 days and get whatever they need to, but right now it's very uncertain. And who's being left behind? India's migrant workers are being left behind. This is taken the day after the quarantine was put in place. March 24th, Prime Minister Modi stated that at 8 p.m., he stated that everyone needs to be home by midnight, which gave everyone exactly 4 hours to get to where they need to be. Unfortunately, these workers, they travel from rural areas to the city to work, and they realized that with this lockdown in place, they wouldn't have any work anymore, so they wouldn't be able to afford rent, they wouldn't be able to afford to feed themselves or their families, and they panicked and they tried to leave. So this is a scene at the train station the next day. there's two big issues here. The first one being there were not enough trains to take everyone back home. So families were devastated. The scene this day was really horrible. People were crying, trying to get home in any way that they could. Many families actually had to walk back to their villages. And so that could be anywhere between 100 miles to 500 miles. I watched an interview of one migrant worker. I didn't put it in because the interview wasn't in English, but essentially he said it would take him 2 days for him, his wife, and both of his children to make it back home. The second issue going on here is obviously this is not a depiction of social distancing in any way. This is a very high density, very compact area. And if even one person had corona here, then there's no telling how many people caught it that day. And on top of that, all of these individuals are going back home to rural areas where the quality of healthcare is quite low. So we don't know if outbreaks are happening in rural areas right now as well because of this. So in general, we don't really know how much this has worsened the situation. Okay, moving on to Mexico. So here's Mexico's COVID timeline. On February 28th, they had their first confirmed case. On March 22nd, 2020, the president of Mexico did a Facebook Live where he stated that if you have the means to do so, take your family out to eat. And this is because he's very concerned about the economy. On March 24th, they had 367 reported cases. However, they are not testing as much as they should be, so it could have been much higher than that. And on March 26th, they had a large outdoor festival, but also on that day, they decided to put to encourage social distancing, and that was the day where all non-essential activities have been suspended. So this sign was put up at a market in Mexico, and it says, "Dear clients, we want to inform you that we will be working here until coronavirus kills us." So how are people being affected? Well, individuals who work at markets are part of Mexico's informal economy, and Mexico's informal economy takes up about 30% of Mexico's GDP. To put this into perspective, the United States, in the United States, our economy is only 5% of our economy is informal. And so there is quite a big difference here. In Mexico, about 1 out of every 10 businesses is 1 out of every 10 businesses are part of their informal economy. And so all of these individuals receive fewer protections. They don't receive healthcare benefits. They don't receive Social Security. They don't receive unemployment benefits. And so it's very hard for them during this time, especially since they have a higher risk of contracting the virus because they are doing jobs such as garbage collection and they're street vendors and they're coming into contact with people every day. And so if they do get sick, they don't really have the resources that they need to try to get better. On April 17th, the president of Mexico announced a $2.5 billion stimulus package, but as of now, that's all that we know. We know that the benefits will go out sometime in May, but he hasn't really expanded on what they will be. So what are the current major concerns in Mexico? Well, first, it's the lack of healthcare. They have a new healthcare system that was put in place by their current president, and he was trying to better it, but unfortunately, he made it worse in terms of that it's more expensive for low-income individuals and for middle-class individuals as well. There's certain procedures that are not covered and certain procedures are not being offered at all now. And so it's a really bad time for their healthcare system to not be as good as it could be. There's also less access to pharmaceuticals because the pricing has gone up a lot. They only have 1.4 hospital beds per 1,000 people, and they only have 2,000 ventilators for the entire country. Their second issue is that they're prioritizing the economy over everything right now. In Mexico entered a recession in early 2019, and they're very concerned as to what this pandemic is going to be doing to make their economy even worse in the future. And so an example of how they're prioritizing the economy is recently in March, they nationalized their oil sector, and they held the president, despite being told by several medical professionals that he shouldn't do this, held a rally in order to celebrate the nationalization of the oil sector. And at this rally, he was seen hugging people, shaking hands, even kissing people on the cheeks, regardless of what's going on right now. And so I think as a leader, he hasn't really been setting the best example. So in terms of the United States, I don't really want to go over our timeline or our stimulus package because I feel like since we live here, we know what's happening, but I do really want to focus on one big issue, and that's how the prison population, as well as the individuals in detention centers, are being treated right now. This first article is by the Washington Post, and it's written by, I really like this article because it's written by federal public defenders. And in this article, they state that multiple people right now in prison have pre-existing conditions. They are over the age of 40, and they're very vulnerable, and it's very easy for them to catch COVID. It also states that their courtrooms across the country as of now are trying to release people who have been convicted for nonviolent offenses, as well as people who are almost near the end of their sentence. However, unfortunately, Attorney General William Barr has stated that inmates are safer in prison than they would be at home. This is a blatant lie. The prison, in prison, the population density is very high, and if one person was to catch it, very easily everyone in that entire prison could catch it. And as of now, this is a problem where people in prison are getting sick, but there's no way to distance them from other prisoners, and people are catching it very quickly. The second article is from The Atlantic. It's titled The Coronavirus is Testing America's Commitment to People's Constitutional Rights. I really like this article because this focuses on how what's happening in detention centers right now is unconstitutional. An attorney wrote it, and he stated, simply put, the government cannot constitutionally seize and detain people, subject them to substantial risk of exposure to COVID-19, and then insist that inaction or half measures are acceptable. And that's exactly what they're doing right now. People in detention centers are receiving no help, even though they're very vulnerable and to the virus. And the article also mentions that several lawsuits are being put in place right now, but if they'll go through or if they'll work, we don't know. So with all of that bad news, I did want to focus on South Korea real quick because they're doing a really, really fantastic job. To begin with, their healthcare is really great. Something I found interesting in my research is when they were reforming their healthcare system, they modeled it based off Japan's healthcare system. And both South Korea and Japan have been the most successful right now in flattening the curve. And since their healthcare is so similar, I feel as if after this pandemic, it'd be really beneficial for countries to compare their healthcare to South Korean and Japanese healthcare and see what we can do to make ours better. Additionally, they have an 11.7 trillion won package, stimulus package. Their population as of now is only 50 million, so 11.7 trillion won or 9.8 billion is a pretty good amount. They're giving up to 1 million won to individuals, excluding the top 30%. After doing some research, I found that average rent in Korea is about 300,000 won. And it's about 300,000 won, so that's pretty good. And then they also have great communication between government and citizens. Additionally, this package right here is what they're giving anyone who has been put into quarantine. And it has toothbrush, food, water, masks, and anything that you would need to keep yourself anything that you would need for 2 weeks of quarantine. And they started giving this out February 28th. So that's way before any other country started giving out any packages. And with that, I want to say thank you for watching my presentation, and I'm now open to any questions.
All right, thanks, Faiza. That was great. Really interesting look at what was happening all around the world. I think it's really valuable information to see. I think we have so much focus on the United States that we sometimes lose track of how other countries have responded and some of the things that have been really successful for them. So the first question that I want to ask you is, in all of your research that you were doing, what were some things that you saw other countries doing that you think we could implement in the United States?
I think the biggest thing is that package that I mentioned briefly at the end that South Korea started giving in February. Anyone who's quarantined, again, it has food, water, mask, toothbrushes, a thermometer, hand sanitizing gel, and just anything that you would need to stay at home for 2 weeks. There's no reason for you to leave your house, and they give it to you before you're even tested positive. So when they test you, if there's a chance that you have it or not, they give it to you to make sure you don't have to leave your home. And in the package, there's a guide as to how to self-quarantine, and also it says how you can receive emergency funds if you need it. And as of now, America has only given aid like mid-April. So the fact that South Korea got on this in February is just like really amazing. And I think we can learn from that.
Is there any other things that you saw that they were doing in South Korea that have helped them flatten the curve?
So I mentioned at the end of that one slide that their communication with the government is really great. And I don't mean this in terms of like information, because I know in America we are receiving information every day, but like not recently, but about a month ago, Trump had that press conference where a reporter asked him, what would you say to people back home? And he just got mad at the reporter. Like, from what I've read in articles, the South Korean government's doing a really good job at comforting their citizens. And I think like in return, there's like a better relationship from what I understand. And just that comfort is helping people understand that things will get better and they're staying home and they're really dedicated to flattening that curve.
Okay, cool. All right. So those are the couple questions that I was going to ask. Now let me see what we got in the chat. We have a great job, Faiza, a great presentation. Queen, someone says. So those all sound pretty good. Excellent work. Someone gave a shout out to BTS. I want to say that's a K-pop group. I'm not 100% on that. Okay. All right. See, I know what I'm talking about. Someone was upset I took their question. So I apologize for taking your question. All right, and then we have one here with thank you for conducting this research. I learned a lot of new information. Actually, they said, what suggestions you have for improving the American response? So apparently all three of us who asked questions were all the same question. So I'm trying to think if I can figure out any other, well, I do have a question. So I know you did a lot of research on this topic. There was a lot of stuff that you probably weren't even able to put into this presentation because there was so much to look at. So is there anything that you didn't include in this presentation or anything else that you found that you think was really interesting that you might want to share?
Yeah, actually, to answer that other question about what more the United States could do, I left out a ton about the United States stimulus plan because I could honestly talk about it for 20 minutes. Like I could give it its own presentation. It's pretty good, but I think one issue that I have with it is like, say you're a parent who has a disabled child, your child is over the age of 19, but they're dependent on you, you wouldn't get any extra money for that child. And if you have lost your job, then it would be really, really hard on you. So I think the United States can like really help its really do better on that front. And additionally, I really wanted to talk more about Japan, but I couldn't find enough information that was like well sourced. Everything is just a little sketchy right now. But I hope that in the future I can learn more about what they're doing as well.
So I know you didn't maybe find well-sourced information about Japan, but was there anything that you did find that you maybe some preliminary stuff that you saw that they were doing that was effective?
Yeah, most of it is just their healthcare. The same thing that South Korea is doing in terms of just like they're testing a lot, they're testing everyone. And again, if they even think you have it, they quarantine you immediately and give you everything that you need to be quarantined. So as I mentioned, their healthcare is so similar. And I think that really is the key to why they've both flattened the curve so well.
So it sounds like healthcare and testing have been really, really important.
Yeah, affordable healthcare, most importantly.
Affordable. Yeah. And then there's another question. Do you know what South Korea did for their vulnerable populations?
Yeah, so I know that the 1 million won is a lot of money. Because it converts to 860, I wasn't quite sure what it could cover, but since it's going to literally everyone who's not part of the top 30%, for if you're part of those vulnerable populations, you can definitely pay your rent with this money, which I feel like is like so much stress off someone's hand, and then you actually have extra to just get whatever you need to. So if you're unemployed, that's a really big help. And I know they have other measures being put in place for unemployment. I didn't have time to add it into this presentation.
Cool. All right. So the person whose question I stole, they got another question. So do you think South Korea's size affects their success?
Yes, definitely. They're only 50 million. So I'm giving them a lot of credit in this presentation. But that being said, like I talked about India for like 3 slides, and I said multiple times they have a population of 1.3 billion. That's a lot of people to take care of. I'm sure if India was at 50 million, they also could put a lot more into place. So it is hard in bigger countries to take care of all those people. So definitely.
And then it's a follow-up. It's actually the same question, but just a separate train of thought. What do you think is preventing us from doing what South Korea or Japan are doing in the US?
Well, to begin with, we didn't put in measures for a really long time. We didn't put in measures until March. South Korea started immediately. South Korea and United States had their first case on the same day, and South Korea by February was handing out care packages. It took United States a really long time. So I think, if we end up having another pandemic, which honestly, that's a whole nother thing to get into, but we might, right? United States needs to start early. I still remember being in class and someone asked one of my professors about COVID because we were in political science. We were talking about current events, and she told us, don't worry about it. It's just like the flu. There's absolutely no reason. And 1 month later, we were all quarantined at home. So I think United States needs to stop being in this mode of denial and understand that things can go wrong in this country and that we need to face it head on.
Yeah, I think that's a really good point because a lot of people were definitely in denial, and that was all everything was people were saying was it's just the flu, it's not a big deal.
Yeah.
But I mean, the evidence was already available if you looked at what was happening in other countries. Like you could clearly find that it wasn't like the flu, but we had all that kind of misinformation happening, and we still have a lot of misinformation. So that's what it also sounds like is really important. All right, so a couple other questions actually, or actually looks like one more. Did you learn anything about how New Zealand responded?
Unfortunately, no, I didn't focus a lot on like anywhere in like Europe or like I focused a lot on Asia. So I hope that in the future I can learn more about them as well. I've really like gained an interest. Like I was interested before, but now that I've started to read up on it, I've gained an even further interest. So hopefully soon I'll know more about New Zealand.
Yeah, and the thing I saw that New Zealand has done a really, really fantastic job, and they have a woman that is their president. And I may be wrong, but does South Korea they also have a
No,
woman?
it's a man. And on okay, in Japan, I've talked really good about them, but one thing I do want to say that really annoyed me during my research is that the president of Japan said that men should go shopping right now because when women go shopping, they take longer and so they'll stay out longer, so they'll spread the virus more, which I thought was like the one of the worst, like it was just so horrible and just sexist. And even if they're doing a good job flattening the curve, they need to like work on their gender inequality after all this is over.
Oh yeah, definitely. I just one thing I saw a couple other places were showing that some countries that had female leaders were doing a really good job handling this. I think it was New Zealand and Germany, and I couldn't remember the other country I saw. But yeah, so great. So also the answer to the question asked before this, they wanted to say that was a great answer and awesome job. It looks like that's probably all the questions we're going to get in the chat. So thanks everyone for tuning in. We are really happy to have you here with us today. Hopefully you learned a lot. I did. I thought Faiza did such a great job with this topic. Really awesome conversation. So just so y'all are aware, tomorrow we have another sustainability talk. It is at 11 a.m. It is going to be about the most vulnerable population, which are so Faiza talked a lot about vulnerable populations, and this is going to look at the homeless population in the United States. And it'll be the second time we've looked into this, but we'll look at it from a little bit of a different angle. And then our last sustainability talk, Kendall is going to be giving that on Thursday, and that will be at noon. And she'll be looking also at different countries and the responses, but she'll look at it from a bit of a different angle than Faiza, and she'll look at some different countries as well. So definitely worth tuning in. And I should say tomorrow, I didn't mention Thomas is giving the talk tomorrow. So sorry, Thomas, for not shouting you out there. But anyways, everyone, thanks for tuning in. We hope you have a great rest of your Tuesday evening, and we hope we will see you back here tomorrow at 11 a.m. Same time, same channel, different Zoom link, but we hope to see you. All right. Thanks, everyone. Take care. Have a great night.